Well, as clinical director for radiation oncology, I lead the team of physicians, the dosimetry people, physicists, and the technologists, all of whom are required in order to get a satisfactory plan for a patient to be treated. Well, for a town with relatively small population, the sophistication we have here is enormous. I mean, you're talking about things that are normally found at university academic centers in terms of the PET scanner, the quality of the equipment, training of the physicians. I mean, we've got an extraordinarily good staff here. It's rare nowadays that any cancer, except for some very early skin cancers or something like that, is treated just by chemotherapy, just by radiation, or just by surgery. Normally, you're talking about a combination of all of these that are involved, whether it's breast cancer or lung cancer. But for example, with the lung cancer, we have our Wednesday meeting mornings where you'll have the medical oncologist, you have the radiation oncologist, myself, you'll have a surgeon there. We all discuss the specific patients, try to figure out what the best treatment would be for a patient, what the best sequencing of these would be for a patient, since sometimes you might want surgery first, and other times you might want radiation chemotherapy first. Having all those people there at the same time is a very big benefit because you can coordinate everything and come up with a coordinated plan of attack for that person's cancer. It's much more efficient. People don't misunderstand each other, so we know exactly what everyone else is thinking. There's many, many benefits to it. But it is kind of rare at a community center to have this sort of cooperation that way. The treatment you're going to get here is comparable to any center you're going to see, whether it's Roswell, whether it's Pittsburgh, whether it's Cleveland. In fact, we have a lot of patients who will come here for their initial consultation. They'll go to one of these centers later on, and in the vast majority of times, they'll come back and say, well, this is exactly the same thing they were going to do. So the treatment here is going to be exactly the same. It's not as if you're going to be doing anything different for the vast majority of cases when you go somewhere else. You come here and you see what the recommendation is here. A lot of people do go for second opinions elsewhere. And in the vast majority of cases, their recommendation is exactly the same as ours. So there's not going to be any difference whatsoever. So why travel 100 miles on a daily basis rather than 5 miles to get your treatment here? And I think we've got an extraordinarily good set of people working for us here.